In this video, we will show you the steps of using the BabySaver to help babies breathe at birth. Prepare for resuscitation. Wash your hands with clean water and soap, then dry with a clean towel. Wear examination gloves and organize your resuscitation equipment in the BabySaver while checking for their cleanness and functionality. Bag and mask. Check that both are clean and functional. Prepare a small and a big mask to prepare for any size of the baby. Put the mask on the ventilation bag. Squeeze the bag and look for the patient valve to open. This shows the device is ready to deliver air to the newborn. Seal the mask tightly to the palm of your hand and squeeze hard enough to open the pressure release valve. Listen for the sound of air escaping. This shows that air that cannot be delivered safely to the baby will escape through the pressure release valve. Maintain the tight seal and check that the bag re-inflates after each squeeze. This shows that fresh air will enter the bag through the inlet valve. Suction device. Squeeze the bottom portion of the suction device and hold the squeeze. Block the opening of the tip against the palm of your hand and hold the squeeze. The suction device must not expand until the tip is unblocked. Stethoscope. Ensure it is clean. Listen by tapping onto the diaphragm to confirm functionality. BabySaver. Ensure that the BabySaver is clean and well disinfected with an antiseptic. Check the clock and ensure there is a second hand and a working one. Prepare for delivery. Prepare the mother and the attendant. Greet and introduce yourself to the mother and her attendant. Show both mother and all attendant what you have prepared for delivery and the newborn baby. Sanitize or wash your hands with soap and water while showing the steps to mother and her attendant. Instruct the attendant to wash hands or sanitize the hands and assign the attendant to inform you the time of birth, the 1 minute elapsed during resuscitation, and the time of cord clamping. Guide the mother to either sanitize or wash her hands. Place the BabySaver on the trolley close to the delivery bed. Explain to the mother and attendant what the BabySaver is. Tell them that the BabySaver will be used in helping the baby breathe in case the baby doesn't breathe well at birth. Open the BabySaver by removing the tray while keeping the resuscitation surface clean. The tray is placed on the mother's bed at her bottom between her thighs to facilitate delayed cord clamping while helping the baby breathe, and the mother should feel relaxed during the process. Show the resuscitation equipment one by one to the mother and all attendant, while emphasizing the use of each. Set the BabySaver for resuscitation. Place the tray inverted on top of the base. This covers the resuscitation equipment and exposes the resuscitation surface of the tray. Cover the resuscitation surface with a soft, warm, dry cloth to cover the baby after drying. Place another cloth on the mother's chest/abdomen to receive the baby at birth. Remove the examination gloves. Wash your hands again with soap and water or sanitize. Wear surgical gloves and deliver the baby. Deliver the baby onto the mother's chest/abdomen, skin to skin. Dry the baby thoroughly. This keeps the baby warm and stimulates breathing. Remove the wet cloth. Change the baby into the second warm, dry cloth from the tray. Wrap the baby covering the head. Check if the baby is crying after drying. If the baby is not crying, you need to help the baby breathe in the golden minute. Transfer to the BabySaver for resuscitation. Support the no crying baby at birth on the mother's chest/abdomen with one hand and pick the BabySaver tray with the other hand. You will expose the resuscitation equipment in the base of the BabySaver. Place the tray immediately between the legs of the mother with the narrow end closest to her buttocks and the broad end facing away. With the umbilical cord intact, you gently place the baby onto the tray. Keep the baby's head on the broad end and keep the baby warm. Ask your helper to cover the baby with extra clothes while keeping the chest exposed. You stand at the head of the tray to position the baby's neck on the tray's neck support. This positions the head into the stabilizer or groove and slightly extends the neck to keep the airway open. Check for secretions and meconium. If not seen, move directly to stimulate breathing. If seen, gently wipe secretions or meconium away with the cloth to clear the mouth and the nose. This removes the largest amount of secretions first. Or suction the mouth, then nose with a penguin suction device only if needed. Stop suctioning when secretions are cleared, even if the baby does not breathe. Suctioning too long, too vigorously, too deeply, or too often can cause injury, slow heart rate, and prevent breathing. Rub the back 2 or 3 times gently but firmly. Do not delay or stimulate longer. Move quickly to check breathing. Is the baby breathing well? And ventilate if needed. If the baby is not breathing well after stimulation, begin ventilation with bag and mask, following the helping babies breathe protocol. You still leave the cord intact. Evaluate the baby during ventilation. Is the chest moving in ventilation or is the baby breathing well? Stop ventilation when the baby breathes well or unaided. Wait for 3 minutes after birth to clamp or tie and cut the cord. continue with the essential newborn care. If the baby is not breathing well, continue ventilation with bag and mask and call for help. You still leave the cord intact. If the baby does not begin to breathe well after 1 minute of improved ventilation, evaluate the heart rate and breathing to decide if ventilation is adequate. If the baby breathes within 10 minutes, stop the ventilation breaths, clamp or tie and cut the cord. Transfer the baby to neonatal intensive care unit for advanced care. If the baby has no heart rate and not breathing after giving ventilation breaths for 10 minutes on the BabySaver, stop ventilation and start counseling the family. Resuscitation on the BabySaver can only continue up to 10 minutes since placental blood will have ceased to flow to the baby. Withdraw the tray and resuscitation equipment. Proceed to clear the delivery environment. Disinfect the ventilation bag, mask, suction device, and tray. Prepare for the next available use.